Coming up in our next hour, plenty to talk about. We will talk some news regarding your health, specifically what you need to know about prostate cancer. All right, did you know that there's new technology out now that can help treat prostate cancer in a non-surgical and radiation-free way? How about that? After the break, we'll be talking to a doctor about this new treatment right here on Good Morning San Diego.
All right, hey, welcome back in. You know, every week we seem to tell you about a new medical breakthrough, or a new procedure that makes our lives a little better, a little bit easier. Today, we are talking about a new technology that deals with prostate cancer for all you guys out there who have been putting this off because you know. Well, joining us here this morning to talk about this new procedure is Dr. Michel, and he is from a place called Lapeer Health Center that is up in LA, and you've made the trip to come join us.
With pleasure, absolutely.
Thank you so much. Now, this is very, very exciting. I guess it's a new treatment for prostate cancer.
Exactly.
Using ultrasound.
Exactly.
Tell us about it.
So traditionally, when a man has prostate cancer, we either take out the prostate using just surgical methods, we actually radiate a prostate. And what we're able to do now is, by using harmless ultrasound waves, we're able to pinpoint with high specificity where the cancer is located, just get rid of the cancer, and preserve the normal prostatic tissue. By doing so, we're able to preserve the normal structures around the prostate, and as a result, actually maintain a man's erectile function and urinary continence while still getting rid of the cancer.
Because that is one of the big problems. If there's a surgical procedure, there can be side effects.
Yes, absolutely.
And talk about that.
So when a man is operated on, such as undergoing a robotic surgery, the cancer control outcomes are excellent. However, there's a significant chance of developing long-term erectile dysfunction as well as loss of urinary control. That is really mitigated by this new technology called HIFU, because of its accuracy and because it's really harmless apart from the area that we're actually interested in. It's able to preserve those normal structures and therefore the normal function for a man.
And just really pinpoint the area of cancer.
Exactly. What's really amazing about the new technology is that whereas before we had a difficult time identifying where the cancer is located, now with newer imaging modalities, we can actually see where the cancer is located. Now that we can see where the cancer is, using methodologies such as HIFU, we're able to just get rid of that cancer and leave the rest of the prostate alone. If you just take a look in terms of what's happened to breast cancer, if you take a look at women 50 years ago, if a woman was diagnosed with breast cancer, we said, look, remove the entire breast. Now, a woman simply undergoes a lumpectomy most of the time, which is just remove the cancer, leave the normal breast tissue intact. The same thing is true for men. Up until now, if someone was diagnosed with prostate cancer, we said, look, just remove the entire prostate or radiate the whole prostate, but we don't need to do that anymore. Yeah. What we're able to do is just do a male lumpectomy, get rid of the cancer, and do that non-surgically. Ultrasound waves, get rid of the cancer, preserve the normal prostatic tissue, and therefore preserve the normal functionality of a man, sexually and urinary-wise.
And how frequently, how often have you used this? How many patients have undergone this, and how has it been?
So we're very early within our stages of treatment because this has recently been approved in the United States as of November. So we're going to be treating our up to 20th patient this month, and that is actually one of the largest series in Los Angeles, actually in the United States, since this has actually been approved. And we do it on a weekly basis, and this month alone we're going to be treating over 5 patients.
And cost-wise, is it similar, and is it covered by insurance?
Exactly.
And, yeah.
So the major hurdle for this is really cost. Because it's recently been approved, most insurance companies do not actually cover this. So
they probably don't know it exists.
They may know that it exists, but the channels that it actually has to go through before it gets approved for reimbursement is significant. Most of the time, it takes about 2 to 3 years before really treatment modalities such as this actually start to get reimbursed. So it's still a cash patient for patients, and but with that, they really get state-of-the-art treatment. And it's interesting, when I took a look at this, I said, like, how many men are really going to pay for this? But when they take a look at erectile function and urinary control long-term in cancer control, people that I really didn't think would be able to afford it have figured out ways to do it.
Now, do you have people working on the insurance industry to get this thing covered? Because it seems pretty important.
Yeah, absolutely. The parent company itself is actually working with the different insurance companies, and it's only a matter of time. But you know what the insurance situation is. When they'll decide to do it, who knows? Right.
So right now, this is only up in LA. And you and your colleagues have this, but perhaps it will trickle down to San Diego someday.
Exactly. So right now, there are a few sites around the United States that actually do this. We're really the main center in Los Angeles doing this, so just up the street. And eventually, I'm sure it's going to come down to San Diego as well. It's just a matter of time.
Yeah, and how exciting is this in terms of medical breakthroughs?
It's really amazing because now I can take a look at a man and say, listen, you're going to have a non-surgical outpatient procedure. You're going to come in 2 to 3 hours later. Your cancer is actually treated, and you go home. You can actually go and have dinner the same night. You're back to your normal functionality. And I talk to men, you know, their erectile function is available to them the next day. The urinary control is outstanding. The last patient I treated 4 days later was canoeing in Michigan. So it really works amazingly. So to be able to confidently look into a man's eyes and say, look, we're going to get rid of your prostate cancer, and very importantly, maintain your quality of life, maintain your erections, maintain your urinary control, is an amazing breakthrough. And again, we are where breast cancer is now, but it's taken us a good 30 to 40 years to catch up, but just removing the cancer and keeping the normal tissue intact.
Is it because there has been recently, maybe in the last 10 years or so, a new focus on prostate cancer? You didn't really hear a lot about prostate cancer until, I mean, maybe 10 years ago that it became really upfront. And as a result, research follows.
Exactly. Prostate cancer really has been at least on the forefront for many, many men. But as we start to talk about it more, and look, the incidence is about 1 in 7 men. That means that if you take a look and you talk to a friend or a family member, there's a high likelihood that you either have prostate cancer or know somebody that has prostate cancer. What's been amazing in terms of prostate cancer technology is the imaging that's allowed us now to identify where the cancer is actually located. Newer technology called multi-parametric MRIs of the prostate have revolutionized the field, because whereas before it was kind of a blind box, the prostate, now we can actually see inside, and with excuse me, new techniques we're able to identify the location, and now with modalities such as HIFU, we can get rid of just the cancer, keep the normal tissue the same. It's amazing.
Well, it's very, very exciting, obviously, for any man who might have prostate cancer, and of course the testing has evolved as well. You have the old-fashioned test, which we all know about, but now there's tests, I guess, that you can send off and get tested to see if you have.
Exactly.
You don't need to go into the doctor and get the probe or whatever you want.
Exactly.
Yes.
Yeah, the probe is still important because we have really amazing blood tests. We have genetic evaluations. But roughly 25% of men will have a normal blood test. That means that rectal examination, a lot of guys, avoid, which really takes about 3 to 5 seconds to do. That picks up about 25% of all the prostate cancers. So it's really, really important that physicians continue to screen their patients including a rectal examination.
Yeah, and you recommend it for anybody pretty much after 40 now.
Yes, I do. And the reason for that is even though the incidence is still low in their 40s, we've treated so many men in their 40s that had they waited until the guidelines, which say, look, you should start to get screened by the age of 50, it would have been too late for them. Yeah. And it's such a simple test. Blood test, quick physical examination, and that can actually save your life.
And it can absolutely save lives. Well, doctor, we appreciate it.
Thank you so much for having me.
We appreciate you sharing this technology with us. Once again, this is ultrasound, using ultrasound to knock out prostate cancer.
Exactly.
And not affecting your other bodily functions.
Excellent chance of preserving everything, absolutely.
Which is absolutely wonderful. Doctor, thank you so much.
Thank you so much for having me.
We will have some of this on our website if anybody wants to look you up and check it out. So we do appreciate it.
Thank you so much for having me.
You got it.